Hi everyone, hope you're doing well. Teresa McLean here. The first week I chose prevention of gun violence as my policies that matter to focus on. Reason for that was because we had recently had a deadly shooting involving an officer who was actually a partner of a friend. It really, really hit home, and I hadn't really thought about gun violence in that way. Never has it hit that close to a friend before, and it got me really thinking about how gun violence and public health are related. So now that I'm re-looking at that, it makes me think of what we've learned with the culture of health over the last couple of weeks, how those steps can be applied to a culture of safety, especially with the action plan one is to simply acknowledge that it is it's a community issue. It's something that all of us are part of. It affects every one of us. And I did a little digging, and I found some very interesting frameworks and models that are similar to the culture of health approach that we learned with the Robert Wood Johnson Foundation. One of the places is the Evidence for Action site, and it's by a framework that is by a physician and public health professional, talking about building a culture of health around firearms, the relationship between social gun culture, gun ownership, firearm policy, and firearm violence. And looking a little deeper into that through the Prevention Institute, it gives recommendations on how that framework can be applied to communities. And this is what I'm thinking of if I was trying to do a community approach on reducing gun violence. First and foremost, sensible gun laws. So you'd have to have your leadership at the table, local government. And you can do only so much with that with, conflicting possibly with state and federal laws, because there has been for years a big back and forth with the NRA and trying to not want any funding contributed to gun violence because of our rights. But CDC recently got some funding for future programs. I believe that was just last year. So hopefully that will turn a little bit more. But definitely leadership at the table. But something that we can control more than I think we realize is establishing a culture of gun safety. And that can involve several people at the table. The first that I think of is education. I remember being in school in middle school, and I don't know if this is still the case or not, in Indiana, we had to pass a gun safety course in middle school. And we learned all about firearms. And in southern Indiana, firearms were part of life. We're farmers, and we all had guns around the house. So I thought it was an excellent program, and to me it was just part of life when we were little, but I don't know if they still do that. But I definitely would want school corporations at that table to instill that kind of education and training, again, even at a young age. The reducing firearm access to youth and individuals. That's why there has to be sensible gun laws to control oversight of who is buying the guns, which is why you would also have retailers at the table, those who sell guns, those who train shooting, those who own shooting ranges, whatnot, so everyone can be held accountable and taught the same respect for firearms. That goes to licensing. Licensing and background checks, that would be someone else at the table to ensure that those standards are held high, that they are looked upon with each and every individual. And in addition to that, not just background checks or whatnot, but mandatory training. If you buy a gun, you need to know how to use a gun. Also, storage safety. Many of the gun violence that you witness on television, young kids, this, that, and the other, are just for the simple fact that guns weren't stored properly. And that needs to also be something that's held very, very highly. I would also have hospitals and mental health providers at the table. they see things on the other side that maybe law enforcement and local government do not see from their perspective. Different ways that we can prevent, especially for mental health resources and people to be taught that there are other ways to deal with violence. And first and foremost, support gun violence research. We're going after, we're being, America especially is we are a society that tends to deal with things after the fact. It needs to be a prevention approach and a comprehensive prevention approach throughout our communities. Also, for those communities that experience trauma, there needs to be support. We can't just run away from this. Just like the action item number 1, it is everyone's responsibility. So primarily we need to vow to change our culture and our responsibility and views toward gun violence in order to make a public change. Additionally, once you get all those organizations together and have a proposed plan going forward of all those different segments, ultimately those things need to be rechecked, regrouped, measurable data to be able to confirm what works, what doesn't work, so you can go back to the table and refine some of those things. That's one thing that kind of drives me crazy when we do projects, even at work, where all these ideas are great. We have all these people coming together. Everybody gets gun ho at the beginning and it just kind of fizzles off at the end. No, you have to keep it up and make it a priority. So I hope in my future public health profession that will be how I am. Again, hope you guys are all doing great, and I'll talk to you soon. Have a great rest of your week.